So I wanted to give you a report on the team meeting that we just completed. I drove in a little early this morning. My normal work schedule starts at about 1 o'clock on Tuesdays and Thursdays, and I work until 7 or 8. But we had a team meeting with the entire team this morning at 7 a.m. So I wanted to report back on how that team meeting went and kind of cover some of the bases of what we had discussed. So first off, I always want my team members to know how much I appreciate them. So that's a big part of any team meeting that I am involved in from a leadership or ownership standpoint. It's important to me not only that they feel appreciated, but that they actually are. The feelings that I have of appreciation for them should be genuine. And if I don't appreciate them, then there's an issue that may need to be worked through, whether it's improving their abilities or capabilities or skills, or transitioning them to a different team or off of the team. But that's important. We started out by discussing what our purpose is, just in brief, discussing why we're in the office, what our goals are at any given day, how we're all generally compassionate, caring individuals, and our purpose is to bless and elevate the lives of the patients that come in to see us. So we talked about that for a little bit. After the discussion of why we're there and what we're doing there, we dug into some of the specifics, front office and back office specifics. So we talked about scheduling. I'm going to give you a real quick run through of some of the bullet points of what we discussed, not getting too much into detail, but we talked about scheduling from the standpoint of managing our schedule rather than our schedule managing us. It's critical that the schedule itself is used as a tool to affect procedures which are in turn providing care for patients. So to reword that, our schedule should be a vehicle that allows us to provide more care for more patients. If we're not treating it as such, or if it's just managing us and we're having difficulty keeping up with what's on the schedule, then we need to reevaluate the purpose of and the methods with which we execute our scheduling protocols. So we talked about scheduling and how patients, we want to accommodate them as much as is reasonable, but because it's kind of like a funnel, we have a bunch of patients calling into the office, we need to direct them where they should go in our schedule so that we can be productive and effective with not only our office time, but the patient's time and the other patient's time. If we just slam a bunch of random appointments into open spots on the schedule, that can become a difficulty going forward. So we talked about scheduling. We talked about who gets the new patients. It's me and my partner, and we have an associate. And for me, my goal is to make sure that my partner and my associate, or our associate, are the first ones whose scheduled are prioritized. So basically, if there's an opening in their schedule and my schedule on the same day, I would fill the opening on their schedule first. And the reason for that is because of the way the partnership works. At the end of the month, if there is going to be some sharing of some income after expenses, because I'm the majority partner, I get a little larger share of that. So I'd like to make sure that they are taken care of from the standpoint of having opportunities to provide dentistry. So that's important to me, that they understand that they're the priority when it comes to scheduling and procedures. After that, we talked a little bit about standards of care. Now, this is a good discussion point that could be hours and hours of discussion. But what our discussion revolved around primarily was fluoride and scaling and root planing versus basic cleanings. So oftentimes as we have discussions with our patients, we need to put our foot down, so to speak, and draw a line whereby the patients understand that this is a standard of care that I can't renege on, I can't bend on, I can't give in. I have to maintain a certain standard of care, and it's in your health's best interest. Now, that's not to say that we can't have different situations, different standards of care for different diagnoses, but there are certain standards that we need to hold firm to. One of those is the recommendation that all of our patients have a fluoride treatment, topical fluoride varnish that's placed at the end of the basic cleaning and recare and periodontal maintenance exams. The other is the use of chlorhexidine gluconate during periodontal maintenance. Those are the two main ones that we discussed. And how important it is that our patients understand that these are valuable and important procedures that are recommended not so that we can nickel and dime you, but because they have substantial benefits to your health. And so rather than having an assistant at the end of the procedure say something like, "So are we doing fluoride today?" which happens a lot, probably not just in my office, but in many offices. Coming from a standpoint of having the assistant say, "Dr. King's recommendation is always fluoride after every cleaning and exam," because we realize the benefits that it has not only to the strength of your teeth, but also helps to kill bacteria that may cause not only tooth decay but gum disease. Your out-of-pocket, your investment in this procedure is whatever, if there is one. Oftentimes fluoride treatments are covered completely by insurance because most insurance companies realize the benefit of fluoride. Or for periodontal maintenance and the irrigation, it's kind of along the same lines. Rather than are we doing irrigation today, which most times the patient may not be really well versed in the recommendation, the reasons for why. So having a conversation with the patient instead of are we doing it, Dr. King always recommends irrigation with chlorhexidine gluconate after and during the periodontal maintenance procedure because, and then you list the benefits, which it flushes the bacteria out of the gum pocket, provides a substantivity that helps to kill bacteria for an ongoing 48 to 72 hours, and helps to kill the bacteria that cause gum disease. Something along those lines. So having that discussion with the assistant and the front office team so that they're aware of why we're recommending them and what we're recommending. So that was a part of the standards of care discussion that we had. We talked a little bit about cell phone use. We run into challenges with some of our less experienced assistants where they'll spend significant amounts of time on their cell phone when they have time in between patients. And let me preface by saying I have no problem with someone checking their phone for a message or a phone call. I don't have any issue with someone doing that on an as-needed basis. My concern begins when we have assistants who every waking hour in between patients are on their phone in the back. And kind of the same applies to smoke breaks, but we'll limit the discussion today to cell phone use. So we talked and discussed about how cell phone use can become not only a giant waste of time, but it's a violation of trust. If I hire someone to work for me as a dental assistant during the hours of 7 a.m. to 2 p.m. or whatever their shift is, I expect them to be on the clock, when they're on the clock, to be focused on doing what they're paid to do. And cell phone time is not part of that equation. I'm not saying that no one should ever be allowed to spend any time on the cell phone. That's definitely not what I'm saying. But I am saying that we need to make sure that they're respectful of the time that they're being paid. So, and that's a two-way street. With especially in today's environment where we have a lot of team members who have children who are doing virtual schooling, it's important that those team members have access to their children and their children's teachers as needed. So it's important that we're flexible, but that it's a two-way street and that there's respect going in both directions. And then in conclusion, as part of that meeting, we discussed a bunch of other details. The conclusion of that meeting basically was, I appreciate you. We, as owners and partners, appreciate you. We value your contributions to the team. Thank you for your patience dealing with the frustration that we're all undergoing with COVID and with the changes in schedules and being shorted for hygienists and assistants. We appreciate all that you do. Let's strive to work better, work harder, work more efficiently, and move forward. So it was, I mean, generally it was a good meeting. We had some good lessons and discussions and opportunities to connect. We didn't have any blow-ups, as sometimes happen in those meetings. There weren't any specific issues that were brought to the front where people were frustrated or angry. I think by and large the meeting was a success. So it was good, a good meeting. It was structured, it was very specific, and we put some timestamps and some recommendations for follow-up going forward. So that's my report of our meeting today. It was about a 2-hour meeting. It was more like 90 minutes, but it was a good, productive meeting. So we'll see how things turn out in the next few weeks.